wonder what understanding about stroke and what guidance did you receive from the neurologist or physiotherapist or the hospital authors when you suffered a stroke?
Right when I suffered a stroke, my neurosurgeon, he advised me to go in for surgery to remove the clot. He just said that since you're a very young girl, you should be fine within the next 6 months and you'll be up and about doing your activities within the 6 months. So we did not have any clear guidance on the severity of the stroke or the extent of the damage caused by it. The way it was told to us, it seemed like a very casual affair and that I'll be up and about running within 6 months and not. We had no idea of obviously the long-term effects of stroke.
So you said that after you had made this surgery, then it would be fully recovered.
Exactly. It was told to us that the surgery would help in aiding full recovery. And we were not even told of any other options other than surgery. It said that surgery would be the best option. In hindsight, we thought we should have explored other options, not surgery.
Did they explain what had happened to you or what it was?
I was 14 years old, so they did not explain to me what happened, but all of this was told my parents. And still, no complete understanding of stroke was given, of the effects of strokes or what would happen and the way to recover, rehabilitation. It felt like their job had ended with the surgery and nothing more.
Okay. What does the exercises do, or specifically for you, or why, or do you think that they are designed for you, especially for you?
Yes, definitely.
And then why? In what way do you?
The Vasa concept works on my brain. So while doing the exercises, it's my brain that is working. It is remapping my brain. So I feel definitely the exercises are designed specifically for my problems, and every exercise it would have a specific goal for a specific person. So even the same exercises could have different goals for two different stroke patients. Because the Vasa concept works on the brain and not the limb per se, it is not designed specifically for a separate person, every person.
And then have you tried any kind of rehabilitation methods other than Vasa concept?
Before I met Dr. Vasa, yes, I mentioned that I had gone to this doctor called Dr. Asa Chitnis, who would practice the Boba therapy school.
And how did you work with your affected part in this other therapy with the Boba?
I used to go to the clinic thrice a week for about an hour each. Effective exercise will not be more than 30-35 minutes. First, they would start with a vibrator. They would use a vibrator over my left hand and leg to relax the muscles. That, in hindsight, Dr. Vasa explained to us that actually caused a lot of my abnormal sensations being aggravated. A lot of passive exercises were done, like pushing a ball or moving my hand up and down. And also for my thumb movement, the therapist would just catch my hand and sit and ask me to try to move my thumb. Even though clearly I couldn't move my thumb, but she would just catch my hand and try to make me move my thumb. A lot of passive exercises basically. There were a lot of exercises where I would call them compensatory exercises, where I would they would show me how to do things with my left hand, my right hand, which I couldn't do with my left.
And what do you think are the biggest differences between those methods and the Vasa concept from your point of view?
The Vasa concept is remapping the brain. It is making the brain relearn. So it is completely different from any other concept that I have ever come across. Benefit of it is that the entire rehabilitation is holistic. So from everything, all the problems that I listed out earlier, Vasa concept has worked on every problem. Even though I'm exercising with my hand and leg, it was affecting, there is recovery in areas of my cognition, my paresthesia, my speech improved, my speech became clearer. So even though the exercises are on the limbs, it is affecting everything, all the other surrounding problems as well.
And how did you feel that the stroke affect you psychologically and emotionally?
I was a very active child. I do have a black belt degree in karate, and I've taken 8 years of classical dance training. So my life prior to stroke was pretty much physical exercise, as in because of my karate and dance, I would spend majority of my time engaged in a physical activity. I used to dance. I used to do a lot of stage shows, performances. So my life prior to stroke was just about physical activity, and that suddenly had to stop. So for me, it was a big. Suddenly, I didn't know what to do because I couldn't do karate or dance, and that was a big change for me to take in. I started feeling very. And plus with all the other problems about plasticity, with my uh, hand getting spastic and staying up all the time, me not being able to walk independently, the atrophy looked really bad, so I had to wear covering clothes all the time. It was a point where I felt very caged, and now I feel very liberated, if that's the right word. Yeah.
And now you feel very...
I feel like absolutely normal. I used to feel like a patient, like an affected, disabled person earlier. Now I do not. I don't have that notion in my head any longer. I feel completely normal and capable of doing anything I want. Earlier I could question the possibility of ever leading a normal life. Now I am leading a very normal life. I would be scared to go out on the street alone, even just to the grocer shop down the road. I would be so scared that I wouldn't be able to go out anywhere alone because I had that fear of falling or collapsing and not being able to walk independently. That I have gone across continents and overseas now.
Oh.
Yeah.
So you feel that now you're not scared anymore, or you're...
Not at all.
Are there any more differences that you have experienced now during the Vasa concept? Or after the Vasa concept? On those, speaking of emotional.
Definitely, I feel that the responsibility of my rehabilitation is with me. It is how I need to put in the amount of work that is required. So I feel more empowered, because I know what I have to do, how I have to do. Earlier we were just clueless. We used to go to the center for the clinic for exercise. That would be around 30-35 minutes, and that would just be over, and we didn't know what to do or when to do or how much to do or what to do in order to recover. And now we feel so much more empowered, and we know what to do, and we can do it. I can do it.
Yes,
Yeah.
you can do it.
I have no fear now. That has completely gone. That is like a forgotten part of my life, all the fear.
Have you ever felt that there's a lack of secure, or that you have felt way too afraid to do any exercise?
No. When Dr. Vasa will start an exercise with me, it would be in a way that I feel that I'm capable of doing it. My body is put in positions where I feel comfortable and capable of doing it. In the beginning, we would start with assistance, like in uh, assistance with the positions, and gradually the assistance would diminish, and then I would be able to do the exercise on my own. So I've never felt insecure or uh, scared to do any exercises, because every exercise has been properly designed to uh, make me start at a pace which I can do, and gradually take all the assistance away and do it independently.
And then, what do you think is the main effect in your rehabilitation from practicing the Vasa concept?
Integration of my right side brain with my left. But yes, I have become. All my motor control has come back, my spasticity has reduced, my speed has increased, my cognition has improved, my fear of falling, I used to catch walls and walk, that has gone, paresthesia has gone, motor control has come back, abnormal movement of my leg, circular pattern, the wrong pattern, that have been corrected. Because I used to walk with a circular pattern and with the heel always staying up on my left side. That has gone. So many improvements.
Then would you recommend rehabilitation exercises based on the Vasa concept to other persons who have had stroke?
I would recommend that they follow only the Vasa concept and nothing else.
Why?
Because it's the only rehabilitation program that has ever showed me any result.
And based on your thoughts about physiotherapy and the relevance in the working area for us physiotherapists, do you think that the Vasa concept would be useful as a rehabilitation for patients who have suffered stroke?
Definitely, I think it would be wise for physiotherapists to understand the Vasa concept and make patients' life much more better than they would be otherwise.
Why?
Because it's shown so much result for the patients. The patients' lives will get so much more better, and if physiotherapists started understanding and working with the Vasa concept.
And how would you describe the Vasa concept for someone that had never heard about it?
I would say that the Vasa concept works with the brain. It remaps the brain into relearning the movements, the motor control, and it trains the brain and not the body, the limbs, which are a symptom of the real problem.
And if that person then asks you, okay, how? What do you mean by that?
I would say that by doing exercise, it sends, while doing exercise, the body sends back feedback to the brain about what you are doing. In that process, the brain learns, and since the brain is learning, your recovery is definitely more permanent, more lasting. Through right guidance and hard work and exercise, you can recover from stroke.
And then thank you so much for your time. And you should know that your participation will be a great help for us develop the knowledge about stroke rehabilitation. So thank you so much for your
No, please.
participation.
No, please. It would